and good afternoon. It is noon here on Friday, and it is time for our regular Lunch and Learn with me, your host, Dr. Polly Heil-Mealey at Abundant Health and Wellness, which is a holistic healthcare clinic in downtown Humble, Texas. So if you are close to Houston, north of Houston, you want to come by and see us. We are at the corner of Main Street and Avenue C. Now today, on this particular Lunch and Learn, I want to talk to you about the importance of vitamin D. Now, vitamin D is something that we mainly know about. We call it the sunshine vitamin. And yes, you can get it if you go out in the sunshine and you have a lot of bare skin showing. And so the optimal time to go outside and get your vitamin D is between 10 o'clock and 2 o'clock, 10 in the morning and 2 o'clock in the afternoon. Now, if you are a working girl like me, it's hard to get out into the sunshine during those hours. And then, of course, in the winter months when we have fog and rain and all that kind of stuff, you're not going to get much vitamin D from the sun anyway because it's filtered through the clouds. So you'll notice in your foods that your foods say that they are vitamin D enriched because vitamin D is a very, very important nutrient. I have a report here. I've got a couple of reports here. And vitamin D is really, really important. And I'm just going to tell you from a practitioner standpoint, vitamin D will protect you against cancer. It will protect you against the flu, and it will also protect you against depression. So if those are anything that you're concerned about, and hopefully all of us are concerned about cancer because 1 in 2 will get cancer. And I think it's 1 in 2 men and 1 in 3 women. So cancer is very much on the rise. And so what we want to do is to protect ourselves against all the toxicity in our environment. Now, toxicity comes in a lot of different ways. But what toxicity will always do is it will always damage your immune system. Vitamin D is very immune protective, and it helps your immune system do what it needs to do. So we want to make sure that we have vitamin D in our bloodstream at the level that we need it. Now, a lot of times people will come in with their blood work, and we do ask them to bring their blood work, and very, very rarely do we have a vitamin D value. And that's because vitamin D is an expensive test, but I think it's very, very important. Whenever we order blood work, we always order a vitamin D test because I want to know where you are. You're coming in here because you don't feel well or you want to reverse some kind of condition, and I'm all about doing that. But if your immune system is struggling because your vitamin D is low, then that's an easy fix. And so always when you go and get blood work, ask your doctor to please recommend that you get a vitamin D test. Most of them don't. They think it's a waste of money. I don't know if they're getting pressure from the insurance company not to do that test or not, but I think it's very, very important. On your reference range, on your blood test, and I know some of y'all are like, you've got your little phone out and you're going to your app, your patient portal on your phone, and you're looking to see your blood work, which is good. I want you to do that. The reference range for vitamin D is 30 to 100 nanograms per deciliter. Now, that's what your medical reference will say is a normal vitamin D level. Holistic people want your vitamin D level to be at least 60 to 100. And so I want you to look at your blood work. You just need to know that there are holistic optimal ranges, and then there is the medical range. So I'm not really quite sure why there is a difference because I would think that everybody would want to be in the optimal range. I know that I do. When I look at my blood work, I don't look at the reference range going down the right side of the paper. I look at the tools that I have as a naturopathic doctor to see what my optimal ranges are. And most of the time, I am in the optimal range. So I love that. And I'll just tell you, when I did my vitamin D the last time, I was at 80 nanograms per deciliter. So I'm well over the 60. And so that's what we need. And as I say, I don't get to go out much, but I'm able to eat the right kind of foods and take the right kind of supplement that gets me where I need to be. Now, I will tell you, multiple years ago, when I tested my vitamin D level, I was like at a 13. Yeah. in the teens. I was horrified because I had learned at how important vitamin D was to the body and to the immune system and the mental health and all that kind of thing. And so I was very, very concerned. And so just because you live, in the southern part of the United States where we do, and we get a lot of sunshine, that doesn't mean that your body is absorbing the sunshine, and it doesn't mean that it's making enough vitamin D. So please, 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 if there's anything that you take away from this little video today, it is to get your vitamin D levels checked so we know where you are. It is a great predictor of your immune health. So what actually does vitamin D do? So it says vitamin D, and there's three forms of vitamin D, okay? So cholecalciferol is one of the 13 essential vitamins discovered by researchers in the early 20th century, okay? Vitamin D is essential for health, and it is firmly entrenched as one of the 4 fat-soluble vitamins along with vitamins A, E, and K, but it technically is not a vitamin. It technically is a hormone, okay? It is generated by the human body with sunlight exposure, okay? And is found only in a few natural foods, and those would be eggs and fish. And so if you are a vegetarian, you are not getting the benefit of the food source, eggs and fish. And so you want to look at that, and you've got to make sure. I don't want to tell you how to eat. I will tell you that as a practitioner, I'm not a fan of the vegan diet. I'm not a fan of the vegetarian diet. There's just too many things that you're not getting. And I know we've talked about this before, and people give me all kind of arguments on how they feel better when they avoid protein, and that's fine. But I'm just telling you, you're going to be missing out on some amino acids, and your amino acids are what the body uses to convert into enzymes, and enzymes drive all of the chemical processes in the body. So I'm just going to throw that out there, okay? It says that vitamin D behaves like a sunshine-dependent hormone, but that doesn't change the important position in our health, okay? It says vitamin D is important to our health because it allows us to use calcium in an efficient manner. Now, almost every system in the body, every process in the body uses calcium. We know that calcium is needed for our teeth, and we know that calcium is needed for our bones. Do you know that when we are eating an acidic diet, we're drinking a lot of sodas, we're drinking a lot of coffee, alcohol, tea, we're eating a lot of gluten, we're eating a lot of processed foods. All of those foods are acidic. When we have an acidic terrain in the body, because the body is a survival mechanism, okay, it will pull calcium from the bones in order to neutralize the acid, okay? So when that happens, if we are not healthy, if we're not processing things properly, the calcium will fall out of solution and it will get stuck in the joints, in the bones, which causes arthritis, okay, osteoarthritis, which we do not want. Now, there are 2 types of arthritis. I thought the only kind of arthritis you could get was calcium depositing in the bones. Not talking about rheumatoid arthritis. That's an autoimmune disease. That's a whole different category. But I'm talking about just the older people when their joints get gnarly and that kind of thing. It is because of calcium building up in the joint because they have an acidic terrain. There is another arthritis that I have recently discovered, and that is bone-on-bone arthritis. That's where the cartilage has been removed, it's been worn away, whatever has happened, and so you've got pain because you've got bone-on-bone without that little cushion there. So we're talking about osteoarthritis here, and that is where calcium is deposited in the bones. You will also have bone spurs if that happens. And so we don't want to have an acidic terrain where the body has to leach calcium from the bones in order to neutralize that acid, because the byproduct of that is that you've got bone spurs and you have osteoarthritis. So we know that vitamin D manages the calcium in the blood, and that's very, very important. It says calcium is one of the elemental building blocks of life on our planet, and its uses include muscle contraction, blood clotting, blood pressure regulation, normal brain function, and insulin utilization and reproductive health. So if you have high blood pressure, it could be that you don't have enough vitamin D. If you've got muscle aches and pains and you're losing muscle strength, that might not be just an age-related thing. That might be that you don't have enough vitamin D. So you want to make sure that your vitamin D is at the level where it needs to be so that you've got enough to go around, because all of us want our muscles to work. All of us want our muscles to contract. All of us want healthy blood pressure regulation. We don't want to go on those drugs that do the regulation of the blood pressure. We don't want to have insulin issues. And so you've got to have enough calcium to make sure all of that goes the way it needs to. And vitamin D is like the regulator that helps everything work the way it needs to. It says, today, there's very little debate in the medical community on the importance of vitamin D. However, the actual blood level needed to achieve minimal, adequate, or optimal vitamin D isn't so clear. So we've already talked to you about that. On the reference range, it's going to be 30 to 100. There are some new studies. Okay, there is a growing body of research that points to levels of 60 or greater to be optimal for immune function. Now, I don't know about you, but as I am getting older, one of the things I'm concerned about is brain fog, and one of the things I'm concerned about is my immune system. Now, I'm good. There's nothing going on with me. I don't want there to be anything going on with me, but I do know that the older you get, then you're going to need more support. You're going to need more nutritional support just because your body is getting older. We don't have the stamina that we had when we were younger, and the telomeres on our chromosomes are shorter, which means they're not going to function the way they need to function. When the cells in the body multiply and divide, right, and that's what they do, they all do that, the older you get, the more opportunity there is for a mutation to occur. And when a mutation occurs, that's when you get sick and disease. And so we don't want any of that to happen. And so that's one of the things as I'm getting older that I want to make sure that my immune system is strong. I want to make sure that my muscles are strong, my strength is strong, and so that all of the vital nutrients that I need, I have, and I have it in adequate supply. Now, one of the things here at the clinic is that we use plant-based material. And so one of the things with fat-soluble vitamins, people will say that you can get toxicity because it's not like vitamin B or vitamin C. They're water-soluble, which means that when you have too much of the vitamin, you just pee it away. A fat-soluble vitamin is not like that. It sticks in the tissue. But that's only if you have synthetic vitamins. If you have plant-based vitamins, then you're not going to have that problem. So I don't want you to worry about an overtoxicity of your fat-soluble vitamins, which vitamin D is one of those, okay? The report says there is a large variety of immune cells that perform broad functions that include turning on and off inflammation. They all require calcium to work properly. These connections with the inflammatory response are likely responsible for vitamin D's diversity of effects, such as decreased rates of cancer and decreased rates of cardiovascular disease. Now, I'm all over that. I don't want to be one of those statistics of somebody that has cardiovascular disease. I don't want to be one of those people that have, that is a statistic with cancer. I just don't want to do that. And so we know holistically that inflammation drives sickness and disease. So we need to make sure that anything that we can do to reduce inflammatory response is something that we need to do. And so vitamin D actually works to do that. So if you're still looking at your blood work, you want to look at two values. I want you to look at the C-reactive protein value. That should be under 1, less than 1. I have seen people come in with 3, 4, 5. I actually saw someone last week that came in with a 12, okay? So a 12 is a lot of inflammation. I also want you to look at your cholesterol levels. Now, I'm not somebody that wants you to have real low cholesterol, and I'll tell you why. Cholesterol is a healing strategy. Your body will make an abundance of cholesterol if you are inflamed. If you have pain, you are inflamed. If you have any kind of degenerative disease like irritable bowel syndrome or diabetes or cardiovascular disease, anything like that, you've got an inflammatory response. If you have swelling, if you have a rash, those are inflammatory responses. And so when you have an inflammatory response, the body produces more LDL, that's the so-called bad cholesterol, all right? The body produces more of that to calm down the inflammatory response. So when you come in and you see me and you've got blood work that shows that your LDL cholesterol is out of range, that tells me that you've got an inflammatory response. We need to find out what is causing that inflammation, deal with the cause, and then your body won't need to make cholesterol in order to damp down that response. Does that make sense to everybody? I hope it does. The other marker that you have in your cholesterol is your HDL, the so-called good cholesterol, and that tells us a lot about your liver function. So we want that number to be over 60 if you're looking at your blood work. The medical profession wants your total cholesterol number to be down below 200 and close to 100. Holistic people do not agree with that because we know the importance of cholesterol. Number one, all of your cell membranes, every cell in your body, 70 trillion cells in your body, the cell membrane is made up of cholesterol. All of your hormones, so we're talking about the hormones that all of your glands make. So not just your sex hormones, your estrogen, progesterone, and testosterone, although those are important, but your hormones that your adrenal glands make, the hormones that your pancreas makes, the hormones that your pituitary, your pineal, and your hypothalamus makes, the hormones that your thyroid and parathyroid makes. You have a lot of endocrine glands. They all make hormones. You have to have enough cholesterol for that to happen. So if you are on a cholesterol drug, you are not going to have enough cholesterol to make hormones, and so you're going to have a hormone imbalance. Now, this is really, really important for us menopausal women, and it's really important for men. Now, I'm just going to tell you, as a young woman, I remember reading or hearing on the news that an actor, and the name escapes me for right now, but he was in his 70s, his late 70s, and he had fathered a child. And people were like amazed that a man of that age could father a child. Well, there was no such thing as erectile dysfunction when I was a young woman. You never heard it talked about. And when it was talked about, it was because the man was very, very sick. And now we have a plethora of young men and middle-aged men and old men that just have erectile dysfunction. And I'm going to tell you why I think that is. I think it is because so many people are on the cholesterol-lowering drugs. They are getting that cholesterol below 200. They're getting it down close to 100, which was what they think is optimal, and they don't have enough cholesterol to make their hormones. And testosterone is like at the bottom of the food chain. So if you look at trends, you can see that in the 70s, when they arbitrarily reduced the level of cholesterol that they wanted you to have in your blood work, they started prescribing the statin drugs. At about the same time, they started prescribing erectile dysfunction drugs. Now, I don't like those either, and I'll tell you why. An erectile dysfunction drug will take the blood flow and it will direct all of your blood flow toward the penis so that we can have an erection, which I'm all about that. That's good. But it takes blood away from the heart and you can have a heart attack. So I'm not a fan of that. Now, holistically, we do have herbs that will, they're called vasodilators. They take the blood vessels and they make them more pliable so they get more oxygen there, so they get more blood there, and that in turn will give you an erection if that's an issue that you have. So we're not against erections, but we are against artificially lowering cholesterol and then needing the dysfunction drugs in order to get there. And I got way off my track here, but I'm just saying that when you have enough vitamin D, you're not going to have your cardiovascular events, okay? The Institute of Medicine, right, they say dosing vitamin D at 5,000 international units per day, we can eventually achieve optimal levels in most individuals. Some individuals, particularly those with dark skin, obesity, advanced age, chronic gut issues, and chronic inflammation may require higher doses. While vitamin D toxicity is extremely rare, okay, it is a real occurrence, higher doses can pose more real danger with hypercalcemia or increased blood calcium levels. Now, that's not going to happen with ours because ours is not synthetic. That's only going to happen if you do a synthetic drug. So a lot of times people will come in and they've got their 50,000 IU dose of vitamin D3 that the doctor has prescribed for them, and they picked it up at the pharmacy. Now, it is a synthetic, and they want you to take one of those per week is usually what the dosage is. Now, I'm just going to give you a little bit of an anatomy lesson, and I don't want to sound like Charlie Brown's teacher, I don't want to do that, but I want you to understand the difference in the different vitamin D things that you can get out there, the different supplements, so you can make a good, wise choice. So the one that you're going to get from the pharmacy is very, very high dosage. Not really worried about that because you're only doing it once a week. But when you take that pill, it goes down into the stomach, hydrochloric acid, all that kind of stuff. You're going to lose some of it during digestion. Then it's going to go over into the liver. It's going to pass through the liver. It's going to get chewed up by the liver, and so that's going to take a lot of it out as well. Why is it going to do that? Because the liver is a filter and it's taking things out that are not supposed to be in the body. Synthetic things are never supposed to be in the body. Whatever is left over is not going to be very much, and it is going to be put back into the bloodstream, and it is going to go into the kidneys. Now, the kidneys is where the body uptakes your vitamin D into the bloodstream so it can do all that it needs to do. So I hope you kind of followed that a little bit. We don't recommend a vitamin D that is a prescription for those reasons. But what we do recommend is a liposomal liquid plant-based vitamin D that you spray inside your cheek, or you can spray under your tongue. There's absolutely no waste. It goes right into the bloodstream at that section so that you're able to uptake everything and get everything that you need. Now, I'm going to tell you here in the clinic, when we've done vitamin D, people have come in and their vitamin D levels are less than optimal. We have seen their vitamin D levels double in 60 days. So say someone comes in and their levels are at 30. In 60 days, we've seen them go up to 60, which is the threshold for me for a healthy, optimal level. And so what we have has absolutely no waste products. It's plant-based, so it's not going to build up in your system. It goes right into the bloodstream so the bloodstream can do what it needs to do. Now, if it only goes through the digestive pathway, through the stomach, and then through the liver, and then gets to the kidney, you're not going to have all that much. So we want to bypass that, and we want to put it in a liposomal delivery system that goes right into the mucous membranes of the mouth, and it goes right into the bloodstream. And that's really the optimal delivery. No waste, and I love that. This is what I use. It's called Solray D, and you need to have vitamin K2 in your vitamin D product in order for it to work. Okay, so go into your cabinet, find your vitamin D, make sure that it has vitamin K2 with it, because that is a cofactor that you need in order for vitamin D to get where it needs to be. Now, as I said earlier, there are 3 different forms of vitamin D, okay? So the sunshine form is called cholecalciferol. The one that is the pre-hormone in the blood that they test is calcidiol. And then the other form is the calcitriol, which is what is made in the kidney. So I know that's kind of like complicated and who cares? Well, you need to care, because if it's not in the right form, then you're not going to be able to use it. And if it's not in the right form, it's not going to do what it needs to do. And you've got to have that K2 in order for it to work properly and be absorbed properly. So I know I'm running out of time, and you're probably going, oh my gosh, that's just so much information. I'm just going to give you some symptoms. If you have these symptoms, you might want to look at your vitamin D level. Number one, if you're prone to infections, if you get infections all the time, you've got this, and then you've got this, and then you've got this, then you want to look at your vitamin D levels, because vitamin D levels will stop you from being prone to infections, because it raises your immunity. And so you need that. I need that. It's been said that if your vitamin D levels are at optimal levels, that you cannot catch the flu. So for me, that's just a better flu shot than anything else. And no, we don't get flu shots around here, just saying that. If you feel tired all the time, if you have a lot of fatigue, there can be many causes for that, but vitamin D deficiency is often one of them. Even having slightly low blood levels of D can have a negative impact on your energy levels. So if your energy levels are bad, then you need to make sure that you get the vitamin D. If you have a negative mood, if you're down in the dumps, if you're depressed, if you're melancholy, all those words, a depressed mood is a common sign of vitamin D deficiency, especially in older adults. If you feel down or you feel irritable, who does that? Who feels irritable, okay? Then there's a good chance that your vitamin D levels are too low. Okay, you need adequate vitamin D to support your mood and to support your brain, okay? If you have weak bones, all right, your vitamin D is too low. Why is that? Because vitamin D regulates calcium. And if calcium is being pulled out of the bones, it is because that you're just low on vitamin D, so you don't want to do that. Vitamin D plays a crucial role in the body's absorption of calcium, okay? So if your bones are weak, you could not have enough calcium in there, and that would be a vitamin D issue, okay? Many women, okay, with bone loss know they need more calcium, yet they're really just deficient in vitamin D. If you take calcium that doesn't have the right cofactors, and I'm getting off on another tangent, and I apologize, but a lot of the calcium out there, especially the cheap calcium supplements that you get, is nothing more than talcum, nothing more than chalk, okay? That's not an organic source of calcium, right? You get a lot of your calcium through your greens, your leafy greens, your dandelion greens, your carrot greens, your beet greens, all that kind of thing. They have a lot of calcium in there. So you want to make sure that if you do supplement with calcium, you're doing a calcium that is organic. You're not doing calcium made from sea coral. Who eats sea coral? Nobody, right? Who eats chalk? Nobody. And so you want to make sure that if you're supplementing, you supplement with an organic source. You might not need that. What you might just need is vitamin D. If you have unexplained aches and pains, Muscle pain and weakness is a red flag that you have inadequate vitamin D levels in your blood. This is because your body's vitamin D receptors are present in the nerve cells at the site of pain. So with that deficiency, right, your pain is going to be increased because it doesn't have the nutrients in your cells that you need. So hopefully you've learned a lot about vitamin D and why it is important. Just to tell you, most people think that you need 9,000 international units a day to keep your levels optimal. If you are optimal, you need 9,000 IUs a day. Now, if you're suboptimal, you're going to need more than that. And so this spray that you spray inside your cheek, it's a real easy delivery system. You're not swallowing gobs and gobs of pills, and you're not doing something that is synthetic. You're doing something that is organic with all of the cofactors in there, and it bypasses digestion, so there's absolutely no waste. If it is 1,000 that you want, one spray will get you. If it is 9,000 that you want, 9 sprays will get you. So you want to look at what your vitamin D level is. You want to look at your symptoms. What are your symptoms? Could vitamin D deficiency be part of that? Get yourself out in the sunshine if you can, but you can also supplement appropriately so that you metabolize that calcium the way it needs to, and you can avoid cancer, autoimmune disease, cardiovascular disease, and all that kind of stuff. So hopefully this has been helpful for you. You're checking your blood work, and you're going to ask your doctor next time to make sure you have a vitamin D panel. And I will see you soon. It's the weekend coming up. Have a great weekend. Enjoy yourself. Be good to yourself. Be mindful that you need to rest. Okay? Take care. I'll see you next week.